Hello dear colleagues, my name is Alexander. I am a doctor and also leading expert and a member of company Tehnodent. I help medical practitioners to choose the best possible materials for daily medication. In this video I would like to talk about materials named Desensetin. Top result in using of our materials is highly appreciated by the dentists not only from Russia but also from CIS countries, West and East Europe, Middle Eastern countries, Southeast Asia and Latin America. For sales you could find the following materials: Desensetin spray bottle 15 ml, Desensetin gel tube 50 ml, flavors tropic, citrus and wild berry, and Desensetin suspension in a syringe 5 ml. Desensetin gel and spray are used for the local application anesthesia of oral mucosa before the injection, for slight injuries, gingivectomy and removal of calculus deposits, teeth eruption and for reducing of the emetic reflex of sensitive patients. Both materials contain lidocaine hydrochloride, 10% in a liquid and 15% in a gel, and surface-active substance cetrimide with antibacterial properties. That is why using these materials we can get not only topical anesthesia but also provide antiseptic treatment of soft tooth tissues before injection. Gel is easily applied to mucosal surface and easily washed out with water. Thixotropic agents of gel allows it to be applied on the lower and upper jaws and on the tongue surface. Spot-on application doesn't let gel spread and effects on receptors of the proper site. The topical anesthesia starts in 60 seconds after application and continues during 25 minutes. Liquid with the help of the Kapp is dispensed on the surface of the mucosa, quickly influenced on the receptors of the application area, and easily washed out with water. Topical anesthesia begins after 20-30 seconds after application and continues during 20 minutes. The maximum recommended volume for application use is 2 ml. One pushing of the pump sprays 0.12-0.15 ml. Desensetin suspension is used for treatment of hard tooth tissues for reduction of sensitivity. This product can be used not only in the clinic but also at home under recommendation of the dentist. This water-based material contains arginine and calcium phosphate. After applying to the tooth surface and rubbing of the suspension into defect, arginine having a high buffering capacity under the influence of saliva forms a complex which blocks and attacks and reduces the pain. Calcium phosphate filling into a defect blocks access of irritants and serves as a source of ions necessary for the remineralization of dental hard tissues. Before the use of suspension, you need to clean, disinfect and dry the injured dentine. Suspension could be applied with the brush or some other applicator on the problem areas of the tooth and intensively rub into the injured surface. Additional amount of suspension could be applied repeatedly without fear of disruption of the structure of the previous portion. The patient is recommended to refrain from food gargling during 2 hours after the procedure, to avoid acid drinks and fruits during 3-5 days after the procedure. For good result, use this suspension 2 or 3 times a year. To consolidate the effect, or in a case of an unexpected occurrence of sensitivity, the procedure can be applied by the patient at home. For use at home, it is recommended for patient to rub the suspension with a finger in particularly sensitive areas of the tooth after cleaning. Also recommended to rinse the mouth with water without much effort and avoid eating for 2 hours. There is a perception. The more expensive material is the better one, and I fundamentally disagree with that. The price of the final product, regardless of its quality, can be different. Company Tehnodent carefully selects raw materials and provides multi-stage control of its quality. All the production is carried out on the modern high-quality equipment according to our developed sites. All the technology of production, packaging and storing smoothly running to the perfect conditions, providing absence of economic losses. We do not make extra charges, placing on the market the high-quality dental materials that meet all international requirements for a fair price. Personally, I would like to recommend you for the daily administration the cost-effective materials from trusted manufacturer with the most convenient form of issuance. Finally, I would like to say, do not forget to talk with the dentist on which opinion do you trust. For sure, they have tested the different materials and with pleasure share with you their observations. I wish you pleasant work and smiley patience. Sincerely yours, Alexander.